The following is a conversation with Dr. Ben Sessa. He's one of the leading researchers worldwide when it comes to psychedelic assisted therapy, a topic which I think is very interesting, honestly, which can be selectively kind of added to a therapeutic setting, and which, quite frankly, a couple of my friends, it really helped, which is why I'm trying to share it here. And so this is what we're going to do today. We're going to dive deep. He has kind of a clinician background, so it's interesting to see where he's coming from and how he got here. And once again, learned a lot of things today in this conversation, and I hope so will you. So, Ben, before we jump in, I'd like to get some definitions straight here, like just to kind of explain the audience what we're going to discuss here, because there's so many substances out there, right? There's from MDMA to psilocybin and a lot of things in between. And from what I understand, they're all very, very different. Could you explain it like I'm five? What is out there and what does it do in super simple terms?
So what are psychedelics in a way?
Pretty much.
Yeah.
And how are they grouped together?
I think I'll just start by saying I'm a medical doctor, and I've been researching psychedelics clinically and in research settings for over 20 years. And I believe that psychedelics provide for us the best, most innovative piece of new technology in psychiatry for the last 100 years. What are they? So psychedelics are drugs. They are what are called exogenous drugs. They come from outside the body. And they have a very peculiar and unique kind of pharmacology in that they create an altered state of consciousness. So if you think of states of consciousness as awake and sober, asleep, in a coma, or death, they're none of those. You are awake, you are alert, you are coordinated, but your consciousness is altered. And in this state, you typically have fluctuations in your sense of perception, your sense of self, your place in the world. Music is enhanced, colors can be enhanced, visual distortions and illusions are typical. But what's interesting about them clinically is they also allow an access to the repressed, unconscious and emotional mind, which, when combined with psychotherapy, can be an incredible tool to help the patient who is stuck and who is finding it difficult to move forward because of a chronic, unremitting mental disorder. So I think the best definition is they are tools that can assist mental health problems when used correctly with psychotherapy.
And actually, on a personal note, I've really experienced this in my circle. I have a good friend of mine, and he was really, he wasn't doing so well. And he did that with psilocybin, and you wouldn't imagine he's like a new person. Like all the bad stuff that was before turned into such a great thing, And he was really in a dark place. So that was for me when I kind of was like, oh wow, this is quite interesting, And for me, personally speaking, I'm a bit of I don't like this losing control part, So I think that's why for me it was never really appealing. But the first time I really saw this in action or in my circle, I woke up and I was like, wow, this doesn't seem to be a voodoo science. This seems to really work, actually.
Yeah. So hearing that is interesting, Enrico, because the psychotherapist in me would say, if you fear losing control so much, then that's possibly something to look at. And what would happen if you lost control? What's the worst thing that could happen? And it brings up a very interesting point, because these are very powerful substances that do in effect make you lose control. But the skill of psychedelic psychotherapy is that you feel safe to do so. You are held, you are contained. It is a loss of control. It is an abnormal state, but it's one that can be extremely beneficial if you allow it to happen and you trust in the process. So a bit like, say, going on a roller coaster or doing a bungee jump or a parachute jump. These are crazy things to do that our physiology is crying out, don't do this. Do not jump out of aeroplanes. Who would do that? It's absurd. You'll die. But when you jump out of an aeroplane with a parachute and with guidance and support, it's an incredibly beneficial experience. So you're quite right. You have to overcome this kind of natural fear barrier that, why would I want to do this? Why would I want to put myself into this crazy state for 6 hours where everything's not all the things I take for granted as normal are not available to me. Why would I do that? And the answer is because you, just like you trust your parachute guide, you trust that, yes, it's a strange, abnormal thing to do, but you know it's going to be okay, and you will benefit from it. And this goes back to the beginnings of human consciousness, that we do tend to enjoy things that push us to limits, as long as we know we're doing it safely. And that's the case with psychedelics. It is a plunge into the darkness, or the lightness, if you like. But you certainly shouldn't do it without adequate preparation and support and guidance, and crucially, integration afterwards. It's the integration period after the psychedelic experience that's the most beneficial part.
It's actually our second episode on the podcast about this topic. So we've already kind of did a deep dive on the neuroscience perspective of all of that. And it was incredibly interesting, actually. And for me, the big takeaway was it's probably, under the proper guidance, going to help tremendously for people who really need the help, because there, I mean, again, I really saw this firsthand. It really does help. And it's just there, and it's available. And at the same time, I am personally a bit afraid, because there's like two cases. The first case is, okay, your brain is in need of help. And the second case is your brain is mostly fine. Of course, we all have our issues, right? Where nobody's perfect, but your brain is mostly fine compared to kind of the worst cases. And I'm just wondering, what is your take on that? Can you destroy a healthy brain with it the same way you save a broken brain to going back to healthy?
Okay, that's a really good question. I think, what you're looking at here is two different ways of taking psychedelics, or motivations or reasons for taking psychedelics. Yeah, we've got the clinical patients with severe mental health problems who are not being helped by traditional treatments, and psychedelics are used as a tool in psychiatry to assist those what we call treatment-resistant patients. And that's the area that most interests me as a doctor. And then there's the use of psychedelics in relatively well, healthy people who do not have a particular mental health diagnosis that they wish to overcome, but they want to have personal growth and development. Now, I like a good analogy here is, you can go to a physio or to the gym or a personal instructor because you've had an injury and you need to do exercises and you need to mend your broken ankle and your bad back or whatever, and you go through this clinical program of exercise therapy for your injury. Or without an injury, just a fit, healthy person, you can go to the gym just to work out and make your already perfect physiology even better and stronger and developed. So I think that's a reasonable analogy with psychedelics. You don't have to be ill and unwell to take them. You can take them just for personal growth and development. And I suppose this analogy also stretches to psychotherapy in general. I think most people go to a counselor or psychotherapy when they're unwell. They present to their GP because they've got depression or anxiety or whatever. They have a course of counseling to mend their anxiety. Well, a lot of people like to do therapy anyway. I've been in and out of therapy all of my life. I've never had a mental health problem. As a psychiatrist, I find it really beneficial to go to counseling and therapy and to have that 1 hour a week with my therapist. I'm not ill, but it's like going to the gym for the brain. I don't have to wait to be ill to do it. So both those different ways of taking psychedelics are valid.
And can you give me like the range? Obviously, in the best case, it's going to help you tremendously. What's kind of the worst case? So let's assume a healthy person, because I think for the person who needs who has mental health issues, anyway beneficial. But for the healthy person, what's like the range from it's going to help you tremendously to?
Yeah, I mean, it's such a broad spectrum of use of psychedelics recreationally, non-clinically, and has been the case for thousands of years, and especially in the last sort of 50 to 70 years since they become popular in mass appeal. And people get a lot of different things out of them. It depends what you put in and the intention with which you take them. If you take a psychedelic in a psycho-spiritual context as part of a ceremony, either, going off to Peru and taking ayahuasca, or doing this in the UK or in Europe or America in a well-being center, you will get the experience you want, and you will have that psycho-spiritual experience. And depending on the intention that you bring along and the things you want to look at, you will find those things. Similarly, you can take a psychedelic in a kind of hedonistic recreational way, and many people do, and people have been for decades, going to festivals or concerts and taking something, or with MDMA going to raves and parties and taking MDMA, and in that context it can give you a sense of communal cohesiveness and connection with your friends and your family and the music and the DJ. And so there's loads of different reasons and agendas for taking psychedelics. The important thing is that they're done with caution and care and preparation and support. Um, what you say, what's the worst that could happen? Well, interestingly, I won't for a moment downplay the power of psychedelics, and that it's absolutely the case that people can have very difficult, challenging, or even horrific experiences. But from a clinical prevalence point of view, the actual rate of lasting harm from any of the psychedelics is extremely low. People talk about acid casualties and frying their brain and never coming back. To a large extent, all those things are urban myths. It's not something that happens commonly. When you think of the wide prevalence of psychedelic use, the actual rate of morbidity and mortality is incredibly low, very, very low. Not even on the scale next to alcohol, or cocaine or amphetamine or these other drugs. So they are, I would never stand here and say they are 100% safe, because nothing is safe, including lions, water, and love. All these things cause harm. But they are very, very, very safe from a epidemiological or statistical point of view. We just don't see our clinics and wards in psychiatry full of psychiatric cases due to psychedelic use. It's not common at all to see those things. But as I said, on an individual basis, you can have a very difficult, challenging experience if you don't do it in the correct way with the correct support.
I guess the biggest risk I see is it being illegal, because it means people have to go out on the street and, well, you might want to buy MDMA, but you might end up buying a completely different thing and you're just not going to know.
Yeah.
So that's why personally I'm very pro, in this clinical context. Like, this is absolutely amazing. But I feel like the way most people do it, let's say on festivals and so on, they might have good intentions. And I fully agree. Everything you just said, assuming it's really the substance, is correct, right? But that's exactly the bottleneck, right?
Yeah, no,
Is it
absolutely.
this substance?
I'm pleased to hear you say that, Enrico, because I agree fully. One of the quotes I often state is, drugs don't kill people, prohibition does. By far the most dangerous aspect of any illegal drug is its illegality, by far. Not just the risk of being caught and prosecuted and how that can ruin your life and, prevent your career trajectory or whatever. It's like you say, it's the risk of impure substance. It's the lack of support, the secrecy with which you need to do it. I've heard of lots of cases of people taking illegal drugs and becoming unwell and not seeking support and saying to their friends, no, don't call an ambulance because I don't want to get busted. So one of the most dangerous aspects of prohibition is people don't seek support when they need it. Whereas if the drug was available and legal, they could openly ask for support. So all of those aspects of the illegality of drugs make them far, far more dangerous. By far the most dangerous thing we can do with drugs is ban them. It hands the franchise to the mafia. It removes completely quality customer services, testimonials, feedback, support. All of that is completely removed. You're handing the franchise into the hands of criminals who have no scruples whatsoever about who they sell drugs to. Pregnant women, children, they don't care. When you regulate drugs, just as if you regulate anything that's potentially harmful, you massively increase its safety. So take, for example, scuba diving. Scuba diving is potentially a dangerous activity, or driving a car, potentially a dangerous activity. If we ban scuba diving tomorrow, it wouldn't go away. People wouldn't stop scuba diving, but they'd go to underground scuba diving centers or underwater scuba diving centers where there's no quality control. The equipment is poor. You can't complain. There's no testimonials, and people would start dying of scuba diving accidents, which they're not currently. So if something is dangerous, the last thing you should do is ban it. If something is dangerous, you should regulate it. So when people do it, they don't come to such harm. So you're quite right. By far the most dangerous aspect of psychedelics is their illegality.
Hmm. And if you were in charge of designing the drug policies for the UK, where you live, I think, right? What would that be in a sentence or two?
You would have a regulated market for the availability of all drugs.
Hmm.
And sometimes when people say, what, even heroin and cocaine? My answer is yes. The more dangerous the drug, the more it should be available in a regulated market.
Hmm.
If we say, yeah, but heroin and cocaine is so dangerous. So what? What? Okay, we'll let the mafia deal with heroin and cocaine, but we'll deal with the other ones. But if they're really dangerous, we'll give them to the mafia to deal with. That's absurd. The more
Hmm.
dangerous the drug, the more it needs to be available in a regulated market. So what you would have is,
Hmm.
like you do for alcohol and cigarettes, you don't ban them. You just make them very difficult to get. You make them
Hmm.
expensive. They're only available through certain accessible outlets. And when you go to that outlet, there's a quality control, there's support, there's education, and there's a purity of the substance, and there's someone there to advise you on the dose, etc. So, yeah, I would have regulated outlets like we have pubs, but for all the other drugs.
Hmm.
And what would happen with this is it would pull the rug out from under the criminal underworld overnight. Suddenly, there would be no crime associated with drugs. Nobody nobody buys black market alcohol, do they? Because why would you do that? Why would you buy some bootleg black market alcohol when you can go to a pub or a licensed outlet and buy real alcohol where you know what it is? So
Hmm.
no one would buy from the underworld if we
Hmm.
had regulated markets. And the financial aspect of this is undeniable. You know, rather than spending £20 billion a year on trying to police drug problems, we would make £20 billion a year immediately on taxes. So it's a
Hmm.
no-brainer that
Hmm.
a regulated market is the best way to deal with drugs, um, in terms of safety, crime, health, society, and everything else, and particularly financially.
Now, if, for example, MDMA would become FDA approved next year, do you think that would kind of mark the beginning of the end for this traditional antidepressant market of the pharmaceutical industry?
That's an interesting question. So I'm a massive supporter of clinical MDMA, clinical psilocybin, clinical cannabis, all of these drugs. But I'm not an anti-psychiatrist, yeah? There is a place for a broad spectrum of different sorts of psychiatric treatments,
Hmm.
including SSRIs, antidepressants, including ECT, including inpatient treatments, um, psychological services, social services. There's no magic wand in mental health and mental illness. No magic wand. And not even psychedelics. So they offer a new way of treating people, so it's an additional arm to the armory of options, but it doesn't mean we need to throw out all the rest of psychiatry. So there'll
Hmm.
always be a place for antidepressants in some people, when they're used correctly at the right dose for the right length of time and carefully
Hmm.
monitored. Um, I'm not in the psychedelics game to throw out the rest of traditional psychiatry. I'm in the
Hmm.
psychedelics game to bring that into traditional psychiatry to be used alongside traditional treatments. So your question, will that be the end of antidepressants? No, I don't think so. Um, Not at all. But they will give us more options than we currently have, which might mean less use of antidepressants and a greater emphasis of good psychotherapy.
Hmm. And what would be your kind of standard operating procedure there? Would you still go through all the legacy kind of methods and then at the end try that? Would you put it somewhere in the middle? Does
Yeah.
it vary from case to case?
Well, with pharmacology and prescribing, the general rule is you never prescribe anything for someone if you can do something without drugs.
Uh-huh.
So they're not number one anyway. If a
Uh-huh.
patient comes to you with depression or anxiety or whatever, your first line treatment is, well, let's look at your lifestyle. Let's look at
Uh-huh.
the situation. Let's look at your relationships, your family, your job, your work. And then you might say, well, let's think about some psychological therapy, some counseling.
Uh-huh.
And then you might start thinking of a drug to be
Uh-huh.
used sparingly alongside these other measures. Um, Drugs are never a substitute for the psychosocial aspects. So
Uh-huh.
where would psychedelics fit in that? It's a good question. The likelihood, given that they're relatively new, in terms of mainstream medicine, is they wouldn't be first line. They would most likely, from a licensing point of view, be second or third or fourth line,
Uh-huh.
which is what the situation is at the moment with ketamine therapy. You have to have tried other things. Now, over time, that might change, and it might be that you don't have to put someone through other treatments. You can come straight to psychedelics. So it depends if you're asking that question of what I would see as ideal or what I would see as the most likely outcome in the coming years. Um, because they are relatively new, they probably won't be first line. You will probably be expected to try other things first. But I think over time that will change if it turns out that they work first line.
Mm-hmm. And who would produce that? Would this still be the big pharmaceutical companies who would basically be in charge of producing that, or are
Of,
these new companies?
of actually synthesizing and marketing the drugs?
Mm-hmm.
Yeah. So, well, by definition, they would be a pharma company. So whether that's
Mm-hmm.
one of the big, well-known ones that already
Mm-hmm.
produce all the antibiotics and antidepressants and cancer drugs and everything else, or whether it's one of these small psychedelic startup pharma companies, they would, by definition, be a pharma company because that's what they do. Um, th- th- it's really interesting the role of the pharmaceutical industry in psychedelics. In some ways, psychedelics are a marketing nightmare. Um, it's very difficult to make any money out of psychedelic pharmacy. Most pharmaceutical products in psychiatry rely on the fact that they're maintenance daily drugs. You know, it costs around $150 million to get a drug from the chemist's bench to the doctor's prescription pad. It takes about 15, 20 years and costs about $150 million. Now, when you're going to spend all that money on research and development, you want to reap back your R&D costs. So if you're going to spend $150 million on developing MDMA or psilocybin, and here's a drug that you only have to take 1 or 2 or 3 times, and then you're better, that's a marketing nightmare. It's absurd. No one would put
Mm-hmm.
that sort of money into it. It works after three sessions, and then you don't need to take it anymore. You can see why why SSRIs and antidepressants have become so popular with the pharmaceutical industry, because once you take them every single day, day in, day out for months, years, decades, and therefore the pharmaceutical industry reap back their R&D costs. So now, what I don't want to do here is suggest there's some kind of conspiracy theory, because I don't believe that's the case. I do believe that psychiatry has dug itself into a hole over the last 40 or 50 years with daily maintenance prescribing, and we're stuck in this apathy that we can't get out of. But I don't believe that there's some evil pharmaceutical cartel who enjoy keeping people ill and
Mm-hmm.
enjoy the fact that they're not getting better. I think that's a grossly offensive and inappropriate conspiracy theory. I know plenty of people in the pharmaceutical industry who want nothing more than to see patients get better. People have this conspiracy theory about oncology, that cancer doctors don't want people to get better because they want to keep working. That's utterly absurd. Nobody wants to see people better more than doctors. The trouble is, a lot of the treatments are just not very good, and they're not getting better.
Mm-hmm.
So there is a place for traditional psychiatry, and there's a place for psychedelics. And even if we have psychedelics, we're still not going to cure everyone, because mental
Mm-hmm.
illness is very, very difficult and very widespread and very prevalent. And it's not an on-off switch. Are you cured or are you sick? Mental health is an ongoing, lifelong process of dynamic development. And we're always going to need support from psychiatric services in some form or other, alongside psychotherapy and social inputs. So, yeah, there is no magic wand, but it would be great to have these compounds available to be used to help our stuck patients.
For me, the medical industry right now is a bit in a strange spot, because you brought up oncology, for example, right? For me, it's so obvious. Why don't we just all go, I don't know, every second or third year, do an MRI, do some blood work and all of that, and you might as well prevent not everything, but a large chunk of it. That's what I do. Literally every 6 to 12 months, I take my blood. I sleep better at night if I know that everything is great. I do the same with MRIs, and I feel like this is such an easy way to do it, and I really wonder, why don't they do it there? And at the same time, also, why was this being blocked so much? This psychedelic research and all of that. It sounds like, if it's not like a conspiracy, what would be your explanation for this hindering of
Yeah.
R&D in that specific field?
Okay, I don't think it is being blocked, because blocked suggests some kind of malevolent attempt to reduce it in an intentional way. I don't think it's being blocked. I just think it's difficult and lengthy and expensive, and we can't get away from that. You know, like I said, getting a drug to market from its conception by a chemist is a 20-year process that takes $150 million. Whether you're making an antibiotic or an oncology drug or paracetamol or aspirin or a psychedelic, it has to go through these hoops. Preclinical studies, in vitro, in vivo studies, phase 1, phase 2, phase 3. These hoops have to be jumped through for any drug development. And I think a lot of people in the psychedelic industry who are not scientists and don't understand this, they're like, why is this taking so long? The answer is, it doesn't take any longer than any other drug. If you're coming up with a new antibiotic, it's the same. But that costs so much money. So the question is, why is it taking so long? And that goes back to what we were saying earlier, because it's so expensive, and who's going to pay for it? Because, like I said, it's a marketing nightmare. This is why the big pharma companies have not really been interested in psychedelics. The conspiracy theorists, and there's a great many in the psychedelic industry because they've all blown their minds, will say, oh, they're blocking it because they know it works and they don't want to see people enlightened. That's bollocks. They're not blocking it. It's a waste of time and money because they're not going to make any money on it. By far, going back to your question, by far the biggest hindrance in the development of psychedelic research is lack of money. If we could throw $150 million at LSD, psilocybin, MDMA tomorrow, they'd be licensed in 2 years, all of them. It's lack of money because you're not going to make your money back. That's the hindrance. It's not because of some malevolent top-down restriction of psychedelics because they're going to open our eyes and make us revolt against government. God, some of the conspiracy theories are absurd. It's simply lack of money because they're not really a good marketing idea, which is
Yeah,
really,
I couldn't agree more.
That's really sad. That's morally and ethically wrong, but it's kind of how it's driven.
And that's exactly my point, honestly.
And that's one of the reasons why cannabis medicine has grown really quickly, because you can make loads of money on cannabis. Cannabis is a maintenance drug. It's worth you throwing $1 million at cannabis because you're going to make $2 million back in 5 years. You need to throw $100 million at psychedelics and you might not make any back at all. You maybe 20 years down the line where there's psychedelic clinics everywhere and somebody owns all of these things, but they're not a good money spinner. But I'm not saying all that to suggest we shouldn't be doing it, because they are the right clinical, moral, and ethical thing to do. And I think maybe we'll be getting onto this, but one of the things about the psychedelic renaissance of the last 20 years, and particularly this huge entrepreneurial boom we saw about 5 to 10 years ago, and a subsequent collapse, is because a lot of people came into psychedelics, weirdly, from the Canadian and Californian cannabis business. They threw their millions into psychedelics, thinking they were going to be as big as cannabis. And then they suddenly woke up and thought, oh my God, this is really, really expensive. And we're not making much money back on this. And we've seen a huge entrepreneurial collapse in the psychedelic market. All of the hopes and dreams of sort of 5 or 6 years ago have collapsed, 95% of them. And psychedelics are not in a good state at the moment, to be honest, around the world. I think they'll pick up, but I think that those entrepreneurs that thought they were going to make a fast buck were kind of surprised when they found they didn't.
And that's exactly my point. I personally also don't think there's a conspiracy going on. I think it's just follow the money. And that's how the world operates, whether it's in medicine or in war or in anything. It's just follow the money.
Yeah,
and I wonder...
the non-patent status of drugs as well. You know, when you create a new antibiotic or a new antidepressant and you own that molecule and you have IP protection on that molecule, it's yours. No one else can make it for, well, it depends on what country you're in, 8 to 10 to 15 years. You own that molecule. Nobody owns MDMA. No one owns cannabis. No one owns ketamine. No one owns psilocybin or LSD. These are off-patent molecules. So if you're going to throw $150 million at creating MDMA therapy, and then anyone can do it, you need to find some way to patent protect it. So what we've seen in the last 5-10 years, particularly in the last 5 years, is a lot of these psychedelic startups are creating their own molecules, coming up with their own analogs of psychedelics that they own. Now, the reason they're doing that is not because they're better. You know, no need to make a better psychedelic than psilocybin or MDMA. They're great. They do everything you need to do. But the only reason people are making new ones It's not because they're better, it's because they own them, and then they can charge for them. So now you can call that immoral or clever pharmacology. I don't know. It doesn't really matter. But the point is, it's a desperate attempt by psychedelic startups to try and make some money on this. Because otherwise, if you spend all that money developing psilocybin and MDMA, then anyone can do it. No one wants to throw their cash at that.
You know, what I'm actually worried about is if this will be marketed as regular medications in the US. Look at how the US is marketing their medications. It's horrible in my point of view. Like literally you get really hard stuff as a TV ad, you know, right now, you know. And I'm just worried if this continues also with this, and then they will create their own kind of deviation of whatever MDMA or whatever it might be then. And then they really will try to shove this down your throat, whether it's good or bad, you know, because they, as you say, they will try to make their money back. So I wonder, what is your stance there? How can you make this safe at the same time and bridge this gap, you know, between, okay, if we do it the proper way, we don't make enough money. If we do it the kind of ultra capitalist way, we're gonna make money, but probably it's gonna harm a couple of people as well. Where do you think that middle ground is?
Well, I think the middle ground is following the science and listening to doctors and experts in the field. Just like we might market oncology medication, you know, you don't take cancer drugs just because you've seen an advert for it. You know, you take it because you've got cancer and your doctor tells you this is the right thing to take. I think that's a true statement. So you follow the science, and you use these medicines when recommended for clinical treatments. Now, of course, that's when we're talking about its use in clinical care. Going back to the beginning of this conversation, we've also talked about its use in the wellness industry and retreats and personal growth and development. And I have no doubt that will be shoved down people's throats. But, you know, let's not use America as a benchmark for normality. You know?
I agree.
Most of the world is not America, and America is insane and very young as a culture, and obsessively capitalistic and consumer driven, and lacking substance, and is incredibly superficial, and is absolutely absurdly politically abnormal, and has terrible equality of services and wealth and economics. With you know, Malawi has a better healthcare system than the USA. So let's not use America as a benchmark for what we should be aiming for. Let's kind of do almost exactly the opposite of whatever they're doing in America, because they've destroyed their country with their consumerism and absence of healthcare. I would look around the world at other places, particularly Europe, as better models of public health and how best to market treatment to patients. The other thing that's worth touching on here is the economic and financial benefits of psychedelic therapy. Now, one thing I often say is there's nothing more expensive than the untreated psychiatric patient. So psychiatric patients, if you don't treat them adequately, cost millions over a lifetime. You know, if you're abused as a child and you develop PTSD in your 20s, and you will cost the health service millions in your lifetime. You don't work, you're on disability benefits, you offend, you go to prison. Your children are taken away by the family courts and require social services care. You require expensive hospital admissions. It's currently about £10,000 a week to be in an acute psychiatric hospital. Now, all of this stacks up over a lifetime and costs millions. So then, when we look at the cost of delivering psychedelic treatments, and there's quite an outcry about this, especially in Australia, where they're developing psychedelic treatments with MDMA and psilocybin. And, you know, and with MAPS and in the States, they estimate about $40,000 for the cost of MDMA treatment. And people are saying, this is outrageous. This is so expensive. $40,000 is nothing. It's a drop in the ocean. If you can treat a patient in the beginning of their early psychiatric career with services for $40,000 and rescue them from a lifetime of untreated PTSD, $40,000 is nothing. It's a drop in the ocean. So although psychedelics seem expensive to deliver as an upfront cost, because it's a high intensity piece of work, it's 2 or 3 sessions, it's hours of psychotherapy time, which is very expensive, lots of monitoring, complex pharmacology, all of this, it is expensive to deliver. But if it works, and it rescues you from a lifetime of mental illness, not only is it the right clinical, moral, and ethical thing to do, but it's the right financial thing to do. It would save billions and billions in psychiatric healthcare for the public purse. So psychedelics have very, very strong economic value. There's no question of that. But you do have to pay up front quite a lot. And this is one of the reasons, going back to this argument of SSRIs and antidepressants, one of the reasons they've risen to the fore is they're so cheap. You know, you go to your GP and you say, I've got depression. It costs a lot of money to do counselling and psychotherapy, or they write you a prescription for Prozac, costs £2 a month or something like that to buy Prozac. It's so cheap, but it doesn't work. So good psychiatric healthcare, whether it's psychedelics or not, is expensive. Family therapy, multiple therapy sessions, lots of time with your psychiatrist. These are expensive pieces of medicine. But if you don't do them, if you cut the corners, you make it much worse because you end up paying millions in the coming months and years. So we need to shift our focus into prophylactic medicine, preventative medicine. And that means good treatment with psychiatric care, with psychedelics or any psychiatric care early in life.
I couldn't agree more. Honestly, this is my life motto when it comes to medicine: proactive versus reactive. And we could save so much money. The thing is, this probably needs to happen on the kind of country level, not the company level, because for the company, it's quite easy to optimize for, well, recurring revenue, right? It's much easier to sell it, as you said, 20 times or 50 times or 1,000 times versus 3 times.
I presume your, I think, fairly invasive approach of an MRI and a blood test every 6 months is something you pay for, yeah? You're not getting this on the public health.
Yes, I pay for it.
So your local radiology department love you, don't they? Going in and £50 MRI every 6 months. Personally, I think it's a bit excessive, but, you know, as you say, if it helps you sleep, then that's great.
For me, it's just knowing that everything is in pristine health. You know, like I want every single biomarker to be in the absolute optimal range, and it gives me a lot of happiness. I know it might sound weird, but I really like to tweak it. And then if something is not good, I optimize and I feel the difference. Even, yes, might be placebo, might not be, you know, but yeah, at the end of the day,
I think, Enrico, I recommend also a monthly psychiatric consultation with myself for you, just to keep you to keep your peace of mind.
Okay, I mean, I'm more than happy to do that if you offer.
Well, I would be charging you, but
no, of course, I'm joking.
I mean, I'm joking with you, but it's an interesting idea because, of course, what we call prophylactic or proactive medicine and preventative medicine are very important, but you can go a bit far, and then you start getting into this realm of health anxiety. You know, and you spend so much time trying to stay alive that you forget how to live. You're going to die, Enrico, pretty soon. You know, we all are.
Yeah.
You've got, what, 86.4 years, and then you're done, and you're worm food, and what's the point? So you can keep trying to stay alive and push it a few more extra years, and I hope you do, but you're still going to die pretty soon. So am I.
Hey, no, what I'm trying to do, I try to do the minimal things that have the maximum output. You know, I really don't subscribe to like Brian Johnson and all these people who really spend their whole life worrying about this and all of that. It's really the farthest from my philosophy. I try to kind of identify the 2 or 3 things I can do that cost me incredibly little time, you know, and I just do those on autopilot. And well, I don't really think about it, quite frankly. It's just, it's being done automatically, and I know it helps me, and I don't waste any real estate of my brain for this, you know, at all, basically.
I mean, like you say, there are lots of little things, aren't there? You know, keep your weight low, eat mainly plants, not too much, don't smoke, use alcohol or other drugs moderately, if at all, and stay healthy in your mind and your body, and have good relationships and be kind to other people. And then you're going to have a fine life, but it's still not going to be very long. So maybe publish a novel or something so your legacy can go on.
That's what we're trying to do with the podcast here, just inspiring or actually educating a lot of people about all sorts of things, you know, because also this I think is a very important topic, because I agree with you that the way it's going on right now in the world, especially in the US, it might have gone a bit into the wrong direction. And it's funny, actually, because, you know, where I live in Switzerland, our constitution was modeled after the one of the US, but it couldn't be further apart, 2 countries, you know, so it's quite funny.
Sad. It's sad. Here in the UK, you know, we had the best health service in the world, and it's collapsing. It really is in a state of collapse. And there's so many complex reasons for that. not all of which can be blamed on issues or people or governments, but that's the situation we're in.
Mhm.
Undoubtedly, the healthiest thing all of us can do is just to live healthier lifestyles. You know,
Mhm.
it's
Mhm.
pretty obvious, that one. But
Mhm.
then also you've got to kind of bear in mind the person who says, "Look, I like smoking and drinking. I like
Mhm.
smoking 80 cigarettes a day, and I like drinking 2 bottles of vodka a day, and I like using
Mhm.
heroin and crack."
Mhm.
And I would say to them, "Great. Well, good luck to you." Sorry, that's my phone.
Don't worry, don't worry.
I would say to them, "Good luck to you. That's fine. Use heroin,
Mhm.
crack, alcohol, become fat and obese, and eat chips every day. Um, but don't expect to get completely free healthcare for that." Um,
Actually, can I jump in here? I have a question for you. Because here in Switzerland, the way it works, you pay around, let's say, 200 to 300 Swiss francs, so dollars or whatever, a month, and you're basically covered. Then there's like a deductible between 200 to 2000 that you have to pay every year, but all the rest is covered. So imagine you have a cancer treatment, uh, you'll pay 2000 Swiss francs, and all of the rest, possibly millions, will be covered, you know?
Mm.
And now I would love to get your opinion here. Do you think that lifestyle should kind of be a factor of this monthly fee? Because I have a very strong opinion there. I really think, people with healthy lifestyles should literally pay less premiums on the insurance versus people who are obese, who smoke, who drink, who do all the, well, objectively bad things. I really wonder, what is your take? Because I know this might
yeah,
be controversial.
it's a really interesting question because on the face of it, the answer should be obviously you should get what you pay for. And if
Mhm.
you smoke and drink and you're obese and you don't go to the gym and you eat poor food, we know the science is very clear. Nobody can say, "Oh, fish and chips are good for me. A bottle of vodka a day is good for me. Cigarettes are not harmful." We've got decades of data that everybody, even little kids, know they're bad for you. So you can't
Mhm.
argue as an adult you didn't realize it was bad for you, but therefore you're making a choice. And then you can understand why someone would say, well, in that case, you shouldn't get unlimited free healthcare.
Mhm.
It should be means tested in terms of lifestyle. Now, that's a kind of very hardline, quite conservative way of looking at things. But if you look at a bit more deeply, the people who do tend to not go to the gym and eat poor food and become obese and smoke and drink are in the lower social economic groups.
Mhm.
And it's not that they don't know it's bad for them, but they're struggling with so many psychosocial issues that
Mhm.
it's very difficult for them to go to the gym. And,
Mhm.
and they smoke and they drink because it's their only pleasure in life because they're traumatized and their lives are so miserable. So, on the one
Mhm.
hand, it is an understandable lifestyle tax. On the
Mhm.
other hand, the privileged people who've got the money
Mhm.
are in a better position to choose a healthier lifestyle.
Mhm.
So, it would be a very conservative
Mhm.
fascist-like thing to do to punish
Mhm.
them further.
Mhm.
I'm not a politician, thank God, I'm too honest. But um, I don't know quite what the answer is. But yeah, we live in a capitalist consumerist society where you get what you pay for, and people
Mhm.
understand that. The answer is education and actually
Mhm.
educating people and bringing them out of that poverty gap
Mhm.
and that situation where cigarettes and alcohol are their only pleasure in life because their life is so
Mhm.
miserable. I
Mhm.
think that if everybody was happier and we managed trauma, people wouldn't want to smoke and drink and become obese. Um,
Mhm.
it's bad food is really cheap. If
Mhm.
I'm going to buy sushi and uh quinoa and healthy foods, this is going to cost me £12 for my lunch.
Mhm.
Or I can
Mhm.
get fried chicken for £2.50, which has got
Mhm.
about 4,000 calories in it. So
Mhm.
it's we need to produce a society with education where it actually pays to be healthy.
Mhm.
And it's beneficial. But in the short term, I can understand the sort of viewpoint of we should be doing means testing on lifestyle. Because
It might be my very Swiss view of things, because obviously in Switzerland, kind of, yes, you have very rich people, you also have poor people, but really the huge chunk of the population is really right in the middle, and they do quite well, luckily.
yeah.
And there, we already have experiments from the health insurance companies who are tracking this. They are tracking, like if you opt in, of course, they are tracking your steps, they are tracking some part of your lifestyle.
Yeah.
And yeah, that seems to work quite well so far. I don't know.
Yeah.
And I,
Yeah. I mean, it's difficult because all around the world there's different temperaments in terms of different cultures,
Mm,
isn't there? And I think the
mm.
British culture is sadly pretty much like, let me go to hell in my own way, thank you very much. You know, I choose to be obese and smoke and drink, and that's my
Yeah.
choice. You know, and you kind of have to respect that. But I mean, in a way, one way of answering this is these things are already taxed. You know,
Mm,
alcohol is taxed, cigarettes
mm,
taxed to pay
mm,
for the people who come unstuck with
mm,
excessive use of them. The answer, from a
mm,
very psychedelic therapy point of view, is treat trauma. Um,
mm,
and then people do tend to choose a healthier
mhm,
lifestyle when they've got
mhm,
that time and that financial cushion.
mhm. Let's go, let's step back a bit and really dive deep into the topic of MDMA,
Yeah,
because I would love to learn more about your MDMA versus alcoholism kind of trial.
yeah.
And I really wonder, like, what was the biggest aha moment in there?
So, okay, why did we do the MDMA for alcoholism trials? So I was working in addictions at the time and saw many, many patients with alcohol use disorder. And I and saw that alcohol use disorder is by far the biggest problematic drug in our
Mhm,
society. But, you know, it
mhm,
eclipses all the rest. We're talking
mhm,
like 20,000, 26,000 deaths a year from alcohol-related disease disorders in the UK. About
mhm,
1,000 deaths a year from heroin.
mhm,
And we put a lot of emphasis in drug services in managing opiate use disorder, but actually alcohol is by far the biggest problem. It's hugely prevalent. Um, so that was one reason why we chose that. The other reason was, as a psychedelic therapist, trauma underpins all addictions, you know?
mhm,
Trauma, in a way, one thing you learn pretty quickly in working in addictions around substances is that the drugs are a red herring. The
mhm,
drugs themselves are not the problem. The problem is this addictive personality or lifestyle, and
mhm,
that is driven by trauma. 99% of patients with addictions have a history of early childhood trauma. Um,
mhm,
and then they're so pained with this that they have to blot out their reality with something. And it might be heroin or cocaine or amphetamine or cannabis or alcohol. It doesn't really matter. The drug's a red herring. And you can't blame the drug. And you certainly shouldn't ban the drug
mhm,
because it's not the drug that's causing the problem. If you All drugs can be taken safely most of the time by most people, and they are. You know, I think we have this perception that drugs like heroin or crack, if you use them once, you die. Of course you don't. If that was the case, we'd have deaths piling up. Most people use drugs most of the time relatively benignly. Um, the few people who become addicts are the people who are blanking out trauma. Um,
mhm,
so one way of looking at it is, if if you work really hard and your boss likes you and your family like you and you've completed all your tasks for the week, Friday night, have a pint of beer. Why not? Saturday night, have 2 pints of beer. That's fine. If you are drinking beer at 9 a.m. on a Monday morning, there's something wrong with your life. Now, you
mhm,
can't blame the beer because that pint of beer on a Monday morning at 9 a.m. is exactly the same as that pint of beer on a Friday night. It's just
mhm,
when you choose to take it. So addiction isn't about the drug. Addiction is about the choice of that drug at a certain time in your life, a
mhm,
certain time in your week, if you like,
mhm,
using that
mhm,
drug to the exclusion of other activities. And if you have such a miserable life, you have poverty, unemployment, poor education, transgenerational abuse, living in terrible housing situations with no opportunities, you may as well be drinking beer at 9 a.m. on a Monday morning. I would be. Yeah, I would be. Nothing else to do. Everyone hates me, no family. I'm a criminal. I've had no education. I've been abused. I'll drink beer at 9 a.m. on a Monday morning. Why not? Um,
mhm,
so that's why addiction occurs. It's not the drug.
mhm,
And whether it's beer or heroin or cocaine or amphetamine or cannabis doesn't really matter. I want something at 9 a.m. on a Monday morning
mhm,
because my life
mhm,
is so miserable. So trauma underpins alcoholism hugely. So at the time we were setting up the study, we were going to do PTSD with MDMA because I knew Rick very well and Matt was doing all of that, and it seemed to be the thing to do. And then we got this very fortunate injection of cash from a donor who had a personal experience in his family with addiction. So I said, let's do MDMA for alcoholism. No one else has done it before. We know that MDMA works for trauma, and we know that alcoholism is underpinned by trauma. So we reckon
mhm.
MDMA would work for alcoholism. And indeed it did. And it was tremendous to do that study. And you asked me, were there any kind of amazing eureka moments? The moments were seeing the MDMA work for trauma. So I guess one question to answer is, how does MDMA work? Yeah. Shall I talk a little on that?
Please. Yeah.
And in order to understand how MDMA works, we need to go back about trauma and childhood trauma. And in order to understand that, we need to understand attachment. Now, attachment is this wonderful, beautiful, reciprocal dance between a pre-verbal child and a primary caregiver, normally a mother, but it doesn't have to be a mother. And it's during this early pre-verbal, in the first 18, 24 months of life, that you develop the blueprint for your psychological state that will last the rest of your life. It's during this period that we learn what is love, what is care, what is honesty. Is it okay to hit people? Is it okay to cheat or lie or steal? Is it okay to drop litter? All of these basic fundamental parts of life that we carry through our whole life, we learn in those first few years. And if you're fortunate enough to be loved and cared for and played with and praised and told that you're smart and funny and attractive and you're going to achieve, then you will do all those things. You will build up a personal narrative about yourself, that you are a worthy, beneficial person. You will build up a personal narrative about the world. Other people can be trusted. The world is safe. People will help me. And these things become very stuck and rigid and carry you through your whole life. And this, going back to preventative medicine, by far the best possible preventative medical or psychological or social thing we can do is to provide excellent care for single mothers with children under 5. If we get that right, we will empty the prisons and hospitals within a generation. So if you haven't had that positive attachment and you build up this personal narrative, I'm bad, I'm worthless, I deserve to be hurt. The world is dangerous. People can't be trusted. Stealing is fine. Hitting people is fine. Violence is good. The police can't be trusted. Everyone's out to get me. You will hold these things for the rest of your life. And in a way, PTSD is the sign of a healthy brain. It's a neuroprotective developmental approach to survival. If you're a little 3-year-old kid, and every time your caregiver comes into the room, they hit you, or burn you, or rape you, you would be a mug to go up to them with your arms held up every time they walked into the room. You learn, when you hear the key in the lock, to dive behind the sofa and hide. Because if you don't, you're going to die. You're not going to get out of childhood if you don't develop a trauma-based perception of the world. It's a survival technique. You're crazy to not be terrified of the world. And so you grow up with this fearful, trauma-based appreciation of the world in order to survive. Now that, fine, it gets you out of childhood and adolescence. But then years later in life, you're age 30 or 40, you've got PTSD, you're in a very benign situation like a queue at the post office. Someone cuts in front of you in the queue and you have a panic attack. Because your brain is stuck in this hangover period. It believes you're still 5 years old and you're being assaulted. You're not. It's a very benign thing that's happened. So PTSD in some ways is a sign of a hangover of childhood trauma. And years later, when you're no longer being attacked, it still kicks in and tells you that things are dangerous and fearful. So this is a very long-winded answer. Forgive me, Enrico. So the result is you've got these people with these easily triggered traumatic brains. And when you're in that position, you just want to drink or take drugs or take heroin. I mean, you don't want pain, and the world around you is painful, and your brain is painful, and the society is painful. And by far the most effective painkillers we know are heroin and alcohol. They're brilliant painkillers. I don't want to be in pain. And if I'm in pain, I'll take a painkiller. And if my pain is so severe that it's with me day and night, I'll take heroin and I'll take alcohol because they're the best we have. So this is why addiction occurs. It's not the fault of the drug. Addiction has occurred when you're a tiny child, long before you ever come across any drugs, including alcohol. So we developed this MDMA for alcoholism treatment service, and it was really, really effective. And one thing that really struck me in seeing the patients is, and this is where psychedelics stand out from other treatments in psychiatry or psychotherapy, is it's the experiential aspect of that drug experience that makes it different from normal psychotherapy. So normal psychotherapy works for trauma. You go along to your therapist, you see them week after week, you build up, you do counseling, you eventually they ask that question, tell me about your rape when you were 10 years old. And in 50% of people, you can do the psychotherapy. That works. You can slowly talk about it and you can overcome that. The trouble is PTSD has a 50% treatment resistance. Because for half of people, when they're asked that question, they cannot go there to that forbidden memory. It's such a taboo. It's so painful. They can't even think about talking about it. And they drop out of treatment. Alcoholism has a 90% treatment resistance. 90% of people, once you get them sober, are drinking again within 12 months. 90% treatment resistance. That's a terrible statistic. After 100 years of modern psychiatry, we were treating alcoholism better in the Victorian times than we are today. Our treatments are so poor. I can't think of any other part of medicine that would accept a 90% treatment resistance. Imagine if oncology or immunology or musculoskeletal disorders or any of these other cardiology had a 90% treatment resistance, and it's not rare. Here's the other thing. Alcoholism is not some weird, rare tropical disease. It's really, really common. It's prevalent throughout society, yet our treatments are no better than they were 150 years ago. So that's why we thought we really need to choose a disease with a high prevalence, a huge financial clinical burden on society that currently has very lousy treatments. So that's why we chose alcoholism. Now, the thing that makes it stand apart from other therapies is, as I said, it's the experiential aspect of it. And I remember one particular patient, and she had been abused as a child, and she was alcoholic, and she was going through the treatment, and she turned to me on MDMA, and she said, Dr. Ben, she said, this is amazing. This is so beautiful. I feel so wonderful. And she said to me, Dr. Ben, is this what love is? And I thought for a second, oh, come on, this is like a transient drug-induced experience. It might feel nice, but it's not love, not real, proper love. And then I stopped before I answered, and I said, you know what? I thought to myself, she feels safe, she feels warm, she feels held, she feels contained, she feels secure. And I said to her, yeah, this is what love feels like. And she went, oh my God, this is amazing. She says, my whole life, I've never felt this experience. Ever since I was born, I've only felt fear and pain. And now I know what it feels like. I know I'm capable of it. And I said to her, exactly. The drug didn't give you this experience. The drug took away the blankets that were covering your capacity to have this experience. And the next day when I saw her, and so the most important session is the next day integration session. Patient's no longer high, but they're back in clinic. And I said to her, I said, yesterday we had this conversation, and do you even remember? Were you just off your face? Were you really high? And she goes, no, I remember every word clear as a bell. And she said, I don't need to be on the drug, because I know what it feels like. And now I know what love feels like. I know I'm capable of it. But I've just never had that feeling before. So that's the experiential part of psychedelics. A lot of traditional psychotherapy, like CBT, you can talk about what it might feel like to not feel depressed, what it might feel like to not feel anxious, what it might feel like to not feel fearful. But with the psychedelics, and particularly MDMA, it's not just an intellectual talking about what it might feel like. It's an actual experience of it. And that shifts a patient from their stuck rigidity towards a new way of thinking. So that's how the MDMA works. It turns off the fear center. It allows you to do psychedelic therapy. It allows you to do trauma-focused therapy that normally you wouldn't do because you would avoid going there. And in doing so, it can shift a patient out of that rigidity that keeps them stuck in that particular disorder, in this case, alcoholism.
I really like this reframing of it's not the drug, it's not the alcohol, but it's really kind of you're the product of your upbringing and all of that,
Yeah.
And that's true, honestly. Like, that's so true, because I see so many people around me, and I know they had a hard childhood, for example, and you see they're more kind of ready to kind of indulge in the maybe not so great things of life. And I think this is actually a big point you're bringing up because, for example, I don't know how it is in the UK, but here in Switzerland, can you imagine how much it costs to put one child through childcare per month? It's like 3,000 Swiss francs. Now imagine you want to have 3 kids. It's just not going to work.
Mm.
So you either, I don't know, going to end up with an unhappy family if both parents are going to work, or if one person is not going to work. Like, it's just not the ideal setup, from the state, where I fully agree. These first 5 years are so crucial. And we should be much more careful designing these, for the child. And
And you
yeah,
save money in doing so, It's
yeah,
financially beneficial to do so.
mm,
Get those first few years right, and you're pretty
mm,
certain you're gonna have a good life thereafter. Now,
mm,
not entirely, and it would be wrong to say that all mental disorders are due to early childhood trauma.
mm,
They're not, and you can have acquired mental health problems from later in life, absolutely.
mm,
And not everyone who does have a poor attachment or abuse as a child goes on to have
mm,
mental health disorders, but
mm,
most do, and it's a very,
mm,
very strong association.
mm,
And this is why, as I said, if we could develop good parenting
mm,
and support for young mothers, we would
mm,
hugely impact lifelong mental health problems in
mm,
adults. Um,
mm,
but the other way of looking at, say, acquired disorders, like what we know also about PTSD is people who get PTSD as an adult, as a result of an adult trauma, like an assault or a rape or something as an adult, the people who've had early childhood trauma are far, far more likely to develop severe PTSD that's difficult to treat. So take combat PTSD, for example. Take 100 soldiers into war, expose them all to most horrific scenes of death, carnage, their comrades being killed and people blowing up. Of those 100 soldiers, 95% of them will actually come back fine. 5% of them will come back with severe combat PTSD. If you then look at those 5 people, hey presto, they've all been abused as children. So
mm,
early childhood trauma even impacts on acquired adult trauma. So, for example, if I was walking home from the train station in the middle of the night through the city and I got mugged and beaten up, yeah, I could develop PTSD from that. But I'm much, much more likely to develop PTSD if I've been beaten up as a child and then that happens. Because if I get beaten up, I mean, I've had a wonderful childhood and a very secure attachment. If I get beaten up on the way home from the train station tonight, I'll be able to say, it was dark, it was a stupid thing to do, it wasn't my fault. But if I've got a head full of trauma from childhood, I'm much more likely to say, this is how the world is, everything is awful and dangerous, and I remember this because my dad used to beat me up the whole time. So
mm,
even acquired adulthood traumatic experiences are influenced by our early child trauma.
mm. And what other applications can this have? Because I've read online that it can also help for couples therapy, for example. Like, can it really save marriages?
One of the core features of MDMA is this sense of empathy, this
Mhm,
ability to see other people's points of view.
mhm,
What we also call theory of mind, putting yourself in someone else's shoes. So you can
mhm,
see how that works in terms of couples therapy, but also
mhm,
just individuals. So, for example, another of my patients on MDMA who'd been abused as a child, I remember her turning to me and she said, I can never forgive what my father did to me when I was 6 years old. And to do that to a 6-year-old is horrific. I can never forget and I can never forgive. But he must have been in a really, really bad place to do that to his 6-year-old daughter. Now,
mhm,
what an amazing statement of empathy to make, you
mhm,
know? Like, you can be
mhm,
in psychotherapy for 20 years and not come up with that. Um, it sort of almost chimes with the sort of Christian values of forgiveness and understanding, doesn't it? It's um, to be able to empathize and sympathize and forgive an assailant or an abuser or an attacker is the cornerstone of healing in psychotherapy. So
mhm,
going to couples therapy, yeah, a lot of uh, disharmony within couples is because you're not really listening to the other person. And with MDMA couples therapy, you really see people saying, "Oh wow, I can really see your point of view. I didn't really appreciate it before, but God,
mhm,
yeah, this it must really piss you off when I do that. I thought it was okay, but I can
mhm,
understand it now." So you can see how
mhm,
it works in couples therapy. It allows you to put yourself in someone else's shoes, and that's
mhm.
a really important part of conflict resolution.
Now, another thing, I'm also curious. Do you, as the kind of administrator of all of this, do you also have to try this before to actually know what it is, or does this kind of blur the professional line, or what's your stance on that? Because actually, I guess it wouldn't make sense. If you give it, you should know what it does, right?
Well,
Physically.
it's a yes and no. I mean, do you have to take antibiotics to prescribe antibiotics? Do you have to take antidepressants to prescribe? Do you have to have electroconvulsive therapy to prescribe it? Do you have to have
Mm-hmm.
had a head injury to be a neurosurgeon?
Mm-hmm.
Do you have to have your kidneys taken out to, you know, carry out a renal surgery? So
Mm-hmm.
it's a yes and no. Um, Now, those are not great analogies. I think to be a good psychedelic therapist, it's the cherry on the cake to also have had psychedelic experience. But in my
Mm-hmm.
opinion, it's not as important as being a great trauma therapist.
Mm-hmm.
You know, when you've
Mm-hmm.
got that patient in front of you and they're struggling through a difficult living out a traumatic experience in a psychedelic therapy session, I would rather have a therapist in front of me who spent years working with PTSD and trauma and depression in
Mm-hmm.
wards and clinics and police stations and hospitals and schools and has decades of experience of working with trauma than somebody who just says, "Oh, yeah, I've not done any of that, but I've taken LSD 100 times." You know, I think a lot of people will disagree with me in the psychedelic community here, and I think this is one of the problems in underground therapy, that people have not had adequate clinical training. They've just had bucket loads of drugs, and
Mm-hmm.
I don't personally think that sets you up to manage a difficult patient case as well
Mm-hmm.
as somebody who's had all the experience in working in clinical medicine or psychology or whatever. So, but on the other hand, yeah, it can't do any harm to have had that drug experience.
Mm-hmm.
And it's a bit of a moot point because pretty much everybody who's interested in psychedelics has had a psychedelic experience. I mean, let's face it. I think
Mm-hmm.
you wouldn't really go into this unless you weren't already experienced in it in some way. So it is important to understand. You can to have had that experience with that compound, you can navigate those mental spaces so much better. But I don't think
Mm-hmm.
it's a substitute for being a wonderful clinician in the first place. So
I guess it's more about pattern recognition, right? You need to, if you do this for 20 years and you really know from the outside how it looks, you will know exactly as a doctor what is going on right now, and
yeah, and
then it's less about doing it yourself.
your skill in working with a traumatized patient is great. Is going to give you
Mm,
make you more skilled than the fact
mm,
you've taken the drug. So
mm,
ideally, you do
mm,
both. But if you had
mm,
to choose one or the other, and of course we don't, if you had to choose one, I
mm,
would choose the excellent clinician over the
mm,
highly experienced drug user.
mm.
Um, they're
Yeah, I think I agree with you here.
they're the person I'd want in the room with me if I was
Yeah.
struggling with trauma. Um,
Mm,
but there's a lot of debate about this in the psychedelic community, and it's a bit of a moot point because almost everyone has done psychedelics. That's why they're doing it in the first place. It's pretty obvious.
mhm,
Um,
mhm,
I'm in a really fortunate position that I can say, as a doctor, I've taken LSD, psilocybin, ketamine, DMT, and MDMA, all legally, and most of
mhm,
them intravenously as well, actually, apart from the MDMA. Um, so there aren't that many doctors that can say that on record that they've legally tried all of those things, and that's just because I've been in the right place at the right time at Imperial College when all of this research was going on, and
mhm,
a lot of us who were involved in these studies were also the guinea pigs for the studies. So we both administering the drugs to others and also receiving them. So
mhm,
I have tried all these things, and it's been very, very valuable to have had those things. But those drug experiences are not what gives me confidence in a clinical session. What gives
mhm,
me confidence in a clinical session is the fact that I know about trauma and I know about medicine and I know about psychotherapy through years of clinical practice. So yeah, I think it is important to have had the drugs, but it's not as important as being a
mhm.
good clinician.
Yeah, I think you're interesting because you've seen both.
Yeah.
You have this strong clinical background, but you've, oh, as you said now, also really experienced it firsthand. And I wonder, like when you look at your life, your life's work with psychedelics, is it more a scientific one or a spiritual journey, if you would
Uh,
have to categorize it?
I don't think there's just those two categories. I would say I'm more interested in, is it more pharmacological or psychotherapeutic?
Uh-huh.
Um, and it's both of those. And like at medical school, I was
Mm-hmm.
really interested in both pharmacology and drugs and psychotherapy. And those
Mm-hmm.
two fields are usually so disparate. And what I
Mm-hmm.
like about psychedelic therapy is it's combining, it's using, when I first started training in psychotherapy, there was a very strong um, narrative within within psychology that you can only do psychotherapy on the sober brain. If your
Mm-hmm.
patient smells of alcohol or is in any way altered, you cancel the session. You can't do psychotherapy. And what I like about psychedelics is, like, we can work in the non-sober brain. This crazy drug state is actually not that crazy. And you can do valuable psychotherapeutic work on this patient under the influence of LSD, psilocybin, DMT, ketamine, MDMA. So that's what's driven me. It's this combination of those two, usually very disparate and separate fields, into one field of psychedelic-assisted psychotherapy. Spirituality. I mean, we can talk about spirituality if you want. You will probably not like my very medical appreciation, but I can tell you my medical appreciation of spirituality if you're interested, Enrico.
Well, actually, I am. It kind of goes into my next question.
Yeah.
Like when everything is stripped away, like the ego, the memory, identity, everything is just gone. Like, what do you think remains with all the background you have, with everything you've seen? I really wonder.
My take on spirituality is a valuable, experienced and known psychological phenomenon. It exists. Yeah. It's existed since the dawn of civilization. It therefore has evolutionary advantage and benefit, or it wouldn't have been selected for in a Darwinian way. We would have lost it by now if it didn't have benefit. So having a sense of spirituality in your life, feeling connection with a greater other, with a God, with a life after death, with a life before death, with a cosmic unity, believing that this physical body is not the only thing and we're part of a greater consciousness. These are all extremely important, valuable experiences. And if you have them in your life, you lead a better, fuller human life, and you're happier and fitter, and you commune with others more. So, big up spirituality. Is there a metaphysical level? In my opinion, no. There is no God. We are ants. We are specks of dust. We are leaves. We are physical bodies. Our brains are incredibly sophisticated. We have the most powerful machine in the known universe in our heads. And one of the things it can do, apart from producing consciousness, it also induces this delusional illusion called spirituality that allows us to get through our 86.4 years. In order to get through our 86.4 years without killing ourselves and being overwhelmed with the stupidity and fragility of life, we invent, but I'm going to live forever because there's a God. There isn't a God. It's electrical activity in the temporal lobes. It's an illusion, but it's a really healthy illusion to have. And so there's a chapter in one of my books called Collusion with the Delusion. If you collude with this delusion, you'll live a better life, but it's not actually real. So that's my take on spirituality. It's really good for you. And whether you get it from Christianity, Hinduism, Buddhism, Islam, or LSD, it doesn't matter. The important thing is to have it. Experience that delusion that there's more to you than just a lump of meat kept slightly above room temperature by complex biochemistry. That's all you are. A lump of meat kept slightly above room temperature by complex biochemistry. When the biochemistry stops, you cool down and you get eaten by worms. And you have about 86.4 years. Get over it. There's no God. There's no heaven. You're a lump of meat. But you're a very, very, very valuable lump of meat. You're my lump of meat, Enrico. And I want you to stay alive and to live your life fully and to love and care for people and be kind. And you're going to die and you'll be forgotten. And it doesn't matter about legacy because no one will remember you in 5 generations, whatever you do. So you have 86.4 years to be as kind to people as possible. And if your way to do that is to talk about an afterlife, then do it. Get into Buddhism, Christianity, psychedelics, whatever. But there's no God. There's no afterlife. We're just organic. It's both. That's my position in life. The other thing I find funny about this is the concept of psychedelic spirituality, which is such an anathema. Of course you feel bloody spiritual. You've just taken LSD. That's what it does on the tin. It says, makes you feel spiritual. I'm much more impressed by someone having a spiritual experience without drugs than with drugs, because then it's like, wow, maybe there is a God then. How come you suddenly had this wonderful mystical experience without drugs? But having a mystical experience on a psychedelic, so what? Of course you did. It's psychedelic. That's what they do. So on the one hand, that sounds so depressing, doesn't it? On the other hand, what I'm saying is it is really good for you. And have spiritual experiences. You'll live a better, more fulfilled human life if you do. But there is no God.
Yeah, for me, this really helps meditation, this breath work. That's really how I get into this state of altered consciousness, honestly. Because especially with the breath work, when I speak to my friends who've done psilocybin, MDMA, and so on, it's really, really, really similar, you know, to the breath work experiences I have.
Yeah.
And yeah, I mean, it's a very interesting explanation you just given. I guess might be right, might be wrong. At the end, we'll never know, right? But I think it's an interesting one, and I see that every person kind of has their own spirituality going on, and I think at the end of the day, the only thing we can do here is really, you have yours, I have mine, and however that might look like, you know, live and let live. That's always how I say it.
And from a clinical perspective, it's an important point you make, Enrico, because from a clinical perspective, it's really important that the clinician doesn't impose a dogma on the patient. And this is one of the things that I find quite frustrating about certain aspects of the psychedelic community. You know, there's a lot of dogma of chakras and energy levels and vibrations and all of this stuff. And not everyone likes that hippie stuff, you know? And so if I've got a patient in front of me, I've had some patients in psychedelic therapy, like with ketamine, some people will say, they'll say, you know, I'll say, what do you think's going on? And they'll say, oh, my amygdala is switched off and I'm having an experience of dopamine and serotonin, and this is helping me to repress my psychological thoughts. And that's like, great, we'll use that framework and dogma. Others will say, my heart chakra has opened and my pineal gland is opening to the energy and cosmic vibration of the universe. So I said, great, we'll use that. I had one patient who said, I said, what do you think happened in this session? And he said, the Lord Jesus Christ came into me and I am now closer to God. And I'll go, great, we'll talk about that then. So the important, and I get frustrated by aspects of the psychedelic community that they say they're open and free, but actually they're very dogmatic with a system of rules and controls and things people should be experiencing. And I think that scares people off. I think it's your job as a doctor or as a clinician to meet the patient where they are and use their framework to explain it, not your own dogmatic thing, which is usually so often in psychedelics is based in some kind of pseudo-Eastern mystical 60s hippie garbage. Not all patients are comfortable with that kind of narrative. So it's your job as a clinician to be neutral. And the most important point about all medicine, not just psychiatry or certainly not just psychedelics, is that the patient gets better. And the patient knows when they're getting better, and they'll tell you what they need to do to get better. And I think that functional outcomes are more important than spiritual outcomes, or even psychological or cognitive outcomes. Functional issues are what brings you into the doctor. You don't go to your doctor saying, I'm having a spiritual emergency, or my cognitions are poor, or even I scored highly on a depression scale. You go into your doctor saying, I've lost my job, my wife's left me, my kids won't see me, and I haven't got any money, you know, and none of my friends like me. You go into the doctor with functional issues, and those should be the treatment goals. And I often say to patients at the beginning of my journey with them, whether it's psychedelics or not, I'll say, look, I'm not going to sit here and take all this money off you for the next year and do all this work just to turn you into a highly enlightened, lonely person. You know, it's not about your personal spiritual development and your enlightenment. It's about what the hell you're doing in your life. And so I think if you look at CBT, the B part of it, behavioral, is really, really important. You've got to say, the patient has to get better. And I'm always saying to patients, look, okay, so you've had this great spiritual experience, but go to the cinema, talk to your friends, join a book club, get a job, call your kids, you know. We're not doing all this just to make you spiritually enlightened. We're doing this for you to have real functional outcomes in your life, because that's what's going to make you happy. Unless you want to just go and live on a roof, on a hilltop in Tibet and just meditate. But if you're going to be in society and amongst other people, functional outcomes in terms of your interaction with family and friends is what we're aiming for.
I think what I'm really taking away from this conversation is that you have an agnostic approach, you know, really with the patient in the center. And you don't say, do this, do that. You say, here's the range. Let's explore how we can help you. And I feel like this is a very healthy and balanced approach that...
And what do you want to find? You ask the patient. That's one of the other things about psychotherapy I really like. I've never met a patient in psychotherapy. They come in on day one and they'll say, what's wrong with me? And I'll say, you know, I don't know what's wrong with you. I don't know you. I have no idea what's wrong with you. You know
Mm-hmm.
what's wrong with you. You have always known what's wrong with you.
Mm-hmm.
And not only that, you also know what you need to do to get better. I don't
Mm-hmm.
know, and I can't make you better, but I feel very privileged to be alongside you on this journey we're going to go through, in which you're going to show me A, what's wrong with you, and B, what you need to do. And I'll be with you and I will fight fastidiously for you and support you. But I'm not going to do anything to you. You're going to do it all, but I'm going to
Mm-hmm.
help you to do it. And then it's going to work. Because if I start doing stuff to you, I might be doing the wrong things and it might not
Mm-hmm.
work. And then you'll blame me. So I'm not going to do anything, but I'm just going to sit here. That's the number one rule of psychotherapy. Don't just do something, sit there.
Mm-hmm. Yeah. Now, to wrap things off, if imagine you can put any message on a billboard, anything, or like, I don't know, push notifications on all people's phones in the world, what would that be and why?
Be kind. You know when you're doing it and you know when you're not.
Yeah.
I mean, there's so many of these sound bites. The other thing, like say the trauma part, only hurt people hurt. That's a good one.
Mm-hmm.
You know, if
Mm-hmm.
you meet someone down the pub who's rude and aggressive and violent, go up to them and say, "Who hurt you?" They'll probably thump you, but you know, who hurt you? Um, just something, I don't know what the soundbite would be, but something that helps people to engage with the reason for their anger and their pain
Mm-hmm.
is because of pain they have felt.
Mm-hmm.
And when they externalize it towards others, they're not really helping the situation and they're hurting people in the process.
I
So,
guess the big problem is that most people, I mean, you're absolutely right, of course, but most people, they cannot even grasp that this is what's going on, you know? It's like hidden underneath. And
yeah.
someone probably like you needs to unlock this for them.
Well, this is where, like going back to those MDMA patients I described,
Mm,
you know, once they glimpse this and realize it and feel it, not just intellectually, but feel it, they don't want to hurt anymore.
mm,
They don't want to hurt
mm,
themselves. They don't want to drink.
mm,
They
mm,
don't want to be aggressive or violent, because being aggressive and violent or using substances harmfully is really, really inefficient way of living your life. It takes up so
mm,
much time and effort. You know,
mm,
being bitter and angry and unkind requires an enormous amount of effort and energy.
mm,
And
mm,
once you realize that there's no need, you're sort of freed to just be
mm,
happy. And it sounds a bit
mm,
hippy dippy, but you know, it it is extraordinary how we haven't realized that, human society. You know, we still fight wars. That's absurd. Wars are
mm,
so absurd. They don't work. They've
mm,
never worked. They're just this
mm,
absurd cry of ego because we're hurt. And the only way to stop that is to stop fighting. And that does mean a
mm,
generation of oppression. But then
mm,
pacifism will work. So, you know, and just as we know within our own interpersonal relationships, if you are aggressive or violent or you hit people, that does not solve anything. So why would
mm,
it work on a national level? It clearly doesn't. But we carry on doing it. Maybe we are just really stupid, you know. We're just not. I think we're at such a weird crossroads in our societal development, where our brains are, on the one hand, incredibly advanced, on the other hand, we're basically monkeys that like setting fire to things. And like, if we can survive the next, I would say, 250 to 1,000 years, we may develop into humanity 2.0, where we
mm,
realize that aggression and violence is not the answer. And
mm,
understanding trauma and caring and loving for people and being kind to them is not only feels really good, but it's financially and economically and ethically and morally the best way to make a machine work efficiently.
mm.
Okay?
Well, couldn't have said it better. I think there's no better way to end this. So, Ben, thank you so much for taking the time out of your busy day. And it really was a pleasure. Thank you
Thank
so
you very
much.
much, Enrico. I've really enjoyed it.
Thank
Good
you.
luck with it.
Thank you. Likewise.